Over the last 24 hours, we identified 531 new cases of COVID-19 and completed about 8,000 tests. Our positivity rate was about 6.7%. There are currently active alerts or outbreaks in 315 schools. Of these, 4 schools are on outbreak with 10 or more COVID cases who attended school in the last 14 days while infectious. As the Premier noted, we continue to see a modest decline in hospitalizations. There are currently 964 people being treated for COVID-19 in hospital, including 218 in the ICU. Pressure is easing a little on our healthcare system, but we still have a long way to go. Sadly, over the last 24 hours, 12 new deaths were reported to Alberta Health. My deepest sympathies are with the family and loved ones of these individuals and anyone else who has lost someone they cared about to any cause. As the Premier announced, we are making some updates to help reduce the risk of transmission in continuing care facilities. I'd like to explain a few more details about these changes. Starting on Monday, all visitors will be required to wear a mask in all indoor areas of the building, including in residence rooms. This applies to all visitors, whether they are unvaccinated or partially or fully vaccinated. The only exception will be in cases where there are significant communication challenges, such as a resident being hard of hearing or an individual with dementia. If you feel your mask will limit your ability to communicate with your loved one, please reach out to your site operator to discuss this. The second change relates to quarantining and testing. We want to make it harder for the virus to enter these facilities. To increase protection, all long-term care and designated supportive living residents, regardless of their vaccination status, must be quarantined temporarily when being admitted to a facility from acute care or returning from a hospital stay that was longer than 24 hours. This quarantine will last only until they receive a negative PCR test. While this quarantine period is expected to only be a few days long, while awaiting test results, I know this can be very difficult for residents and families. This is intended to help prevent the virus from entering these facilities, where we know it can possibly spread quickly and put many at risk. I will also be sending a letter out strongly encouraging families and friends who are not fully vaccinated to not visit or attend to residents in person. I know this will impact residents in different ways, but it is very important to help protect residents and staff from COVID-19. Fully vaccinated Albertans who have no signs of illness can continue to see their loved ones who are residents in these facilities as often as they wish. While this is a recommendation, in the letter I will also reinforce that operators have the authority to implement additional mandatory measures in their facilities as appropriate in consultation with their residents and families. This could include requirements for proof of vaccination or rapid testing for visitors entering the site. Operators have worked incredibly hard throughout this pandemic, and their goal is always to protect the health of our loved ones who live in these facilities. It is essential that all visitors to continuing care facilities follow all rules in place, whether set provincially or locally.
As of this afternoon, as you've heard, we have 376 general adult ICU beds in the province, with 75% of those occupied by someone needing critical care. And without the additional 203 surge spaces, we would be at 163% occupancy. While we have seen the number of COVID patients in ICU come down over the past couple of weeks, we continue to see high numbers of Albertans need ICU care for non-COVID reasons. This is partly due to our decision to carefully increase the number of surgeries that our teams are performing each week. More surgeries means more patients needing intensive care post-op. This is what our system is designed for, and as pressures created by COVID decrease, we are able to use more of our ICU beds for their intended purpose. More surgeries also means having surgical staff and anesthetists return to the operating rooms and post-anesthetic recovery rooms to care for patients who need surgery. So I cannot say thank you enough to the surgical teams who are redeployed to help in our ICUs during a time of great need. As of this morning, approximately 92% of our full-time and part-time AHS employees have submitted proof of having 2 doses of COVID-19 vaccinations. Approximately 92% of physicians working in AHS have done the same, and more than 97% of our ICU staff are fully immunized. 7% of our staff have yet to submit their proof of vaccination, and we're actively working to confirm their vaccination status. Less than 1% of our staff and physicians are seeking an accommodation under the policy. So overall, this tells us that there's very broad support for the mandatory vaccine policy. These are impressive numbers, and we're extremely grateful to all of those who have submitted their proof of vaccination. We stand by the policy, and it will be fully implemented. This vaccine requirement is essential. As mentioned, only a small minority are seeking an accommodation under the immunization policy, and as of this morning, we have received about 1,200 requests for accommodation on medical or religious grounds, with about 830 having submitted the required paperwork to allow for full evaluation of their accommodation request. That's less than 1% of our staff, physicians, and midwives. Accommodations to the AHS policy will be made for medical or religious reasons, except where a workplace accommodation is approved. Those employees who are not fully immunized in compliance with the policy will be placed on an unpaid leave of absence. With such low numbers, we don't anticipate the policy having any significant impact on our ability to provide care to Albertans. We've also been tracking resignations specific to the implementation of the vaccination policy. To date, 61 employees have resigned, including 31 in clinical roles, of which 11 are registered nurses. AHS strongly encourages those staff who remain unimmunized to get their immunization as soon as they can and to address any concerns they may have with their leader or healthcare provider. We will continue to talk with our employees, to answer their questions, and to urge them to get immunized if they haven't already done so.